Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. So today I wanted to bring to you a topic that is actually kind of interesting. It's coming up in a lot of my payer audits and also in my practice audits, that the G0101, which is a pelvic and breast exam HCPCS code for Medicare, is being reported with preventative medicine codes, the 9938 series, whether it be new or established. Also, sometimes I'm seeing the 99213 or 214 E&M service also billed, and of course then we also see sometimes the Q0091, which is obtaining a screening pap smear. So let's talk about when all of this is appropriate and when it isn't. So first, Medicare developed these two codes for screening services for women without definitive frequency time limits, which is good. So both the G0101 screening breast and pelvic exam and Q0091 obtaining a screening pap smear can be billed every 2 years for low-risk patients and every year for high-risk patients. So, when there's no limits, but there are frequency guidelines, let's say. So these are not comprehensive preventative medicine services. So can they be billed on the day of a covered service like a well visit or separate problem-oriented visit? Or routine preventative care services? Yes, as long as the payer allows it. And there are some commercial plans that will allow the codes from the 99381 to 99397, which in my interpretation include a pap and pelvic, it's also age appropriate, but that's okay, and a breast exam. But there are some payers who will pay for both the G code and then also the preventative. Now, Medicare Advantage plans, they set their own rules about preventative service coverage, so make sure you look on that. And then also we'll talk about the 99459. That's the additional pelvic exam that can be added to office visits only, but they can't necessarily be added to the preventative or the screening exam, but I'll talk about that. Sometimes you can, sometimes you can't. Again, very payer dependent. So in case you didn't know, Original Medicare does not pay for annual routine physical exams. They have the annual well visit. That's different. That doesn't include a physical exam. And this definitely is, a frustration for gynecologists, primary care providers, and Medicare patients. So because they do pay for an initial welcome to Medicare visit, an initial wellness visit, and subsequent wellness visit, again, those annual well visits, they're usually done by family physicians, internists, geriatricians, but not so much by gynecologists because they're not doing the entire scope of what's included in those. And, you can always go to my website and see what that is. But Medicare pays for an annual screening pelvic and breast exam with that G0101. But hear what I'm saying here. Annual screening pelvic and breast exam. It does not say and or. So if the patient is at high risk for developing cervical or vaginal cancer, if they're childbearing age with abnormal pap test within the last 3 years, or for every 2 years for women at normal risk. Okay, so Medicare also pays for that Q code, the Q0091, at the same frequency as the G0101. So do they have to pay a copayment or deductible or coinsurance? Not for Medicare, no. So the G0101, be clear, defined as cervical or vaginal cancer screening, pelvic and clinical breast exam. So that has to be documented. The Q0091 is defined as screening, papilloconal smear, obtaining, preparing, and conveyance of cervical or vaginal smear to the laboratory. So, there's a lot of diagnosis codes, high and low risk, that you want to consider for these. They usually start around the Z92.8 and then get your extra digit code, so make sure you look at those. Now, the pelvic exam add-on code that's in the CPT book. This is not a HCPCS code specific to Medicare. This is a 99459 add-on code. We got it last year in 2024. And it was an add-on to new and established patient codes, the 99202 to 215, consult codes, which nobody pays for, of course, and preventative medicine codes 99383 to 99397, whether it be new or established patient. So it's worth around $20. But what it does is it's to cover the practice expense, so the PE for performing a pelvic exam. When the RUC committee, which is AMA's committee that they help value practice expense and how many, what codes should be valued at, this includes both the staff time and the supplies. It's valued with 4 minutes of staff time and the supply kit of around, again, $20. Doesn't mean you're going to get paid $20, but that's about the national, average they're valuing into the code. So I was on a call at the virtual 2024 AMA CPT symposium, and a question and answer came up, said, well, since it includes practice expense for both staff and supplies, do we have to have a chaperone in order to report the add-on code? Their answer was no. Now, I didn't interpret that when it first came out, so I may have said, you need to have a chaperone until they said that, and they actually recorded it. So they state that the 99459 add-on was developed to capture additional practice resource expense that's needed when a pelvic exam is performed, pointing out that the code is a practice expense only. And so why the valuation does include a chaperone, it's not required, which again doesn't make sense to me. But the pelvic exam does have a supply expense. So, we're going to do what they say. We know there's additional staff time in setting up the room for pelvic, and if a PAP is done, for preparing and transmitting the specimen. The total RVUs in both the facility and non-facility are 0.68. So the national reimbursement, again, with our current conversion factor, is about $22.24 to 26 cents. Depends on, what payer it is. So you can use it with both preventative and problem-oriented visit if it's warranted. Make sure it's, it is warranted. I saw somebody try to use it when it was deferred, and I'm like, seriously? I don't think so. They're like, well, because we thought about doing it. I'm like, no, let's not go there. So, you don't have to put the 25 modifier to it because it's an add-on code. And so just know that you just be careful with that. Now, the breast and pelvic exam, I want to go back to G0101 because I know Anthem Healthcare and some of the United Healthcare policies, I know there's a Blue Cross Blue Shield policy in the Southeast that allows both the preventative and also the G0101 to be reported. And I know one of my clients actually had emailed me and said, because they allow it, can we go ahead and bill it even though I know there's some crossover? Well, first of all, you make sure that you are doing both the PAP and pelvic. And the breast exam. I can't stress that enough. When I audited this code, I found that most of the time there was not a breast exam. And so what it includes is you have to have, it requires, now that doesn't mean it suggests, it requires 7 of 11 exam elements. So here's what what this is, my interpretation is that examination of the breast is mandatory to bill the G0101. Now it says inspection and palpation of breasts for lumps, tenderness, symmetry or nipple discharge. Digital rectal exam is controversial. That's supposed to be included, but again, if the patient defers and it's in there deferred and why, then I don't see that being an issue. But the pelvic exam, including external genitalia, urethral meatus, bladder, urethra, vagina, cervix, uterus, and too much coffee this morning, anus and perineum. So you have to do a complete breast and, again, pelvic exam. And so if you bill this in addition to your wellness visit, yes, you will probably get paid for it, but you just have to make sure that it's complete. And if it doesn't, because there's no separate pelvic exam at a problem-oriented visit. It doesn't have a separate code. There's no separate breast exam only. That doesn't have a separate code. They're part of the E&M service in that exam area. You've seen all the different system exams. So this is definitely a screening difference. And so for a wellness visit. Now, you want to make sure that you also link the diagnosis specific to the G0101, which would be Z00.00 or Z00.01 in the first position. And yes, there may be patient's chronic conditions added to the claim form if addressed for the newer established patient. And always be careful with that. I'm seeing so much routinely billing an office visit with screening codes or with preventative codes, just because they say you can, but if the patient's there specifically to address their chronic conditions and they're not scheduled for their pap and pelvic and breast exam or not scheduled for the preventative, then it's inappropriate. You can't just slide it in. If they're there for their preventative, they're there for their pelvic breast exam, and abnormalities found or a significant problem with their chronic condition has to be addressed above and beyond, refill prescriptions, then it may be able to be billed. But be careful with that, because now they've got an out-of-pocket. So according to Medicare, also the covered diagnoses for reporting G0101 and Q0091 together. For high risk, it's going to be Z72.51 all the way to Z77, and then it starts at 0.29, 0.9, and Z91.89 or Z92.89. So look at those codes specifically. Low risk would be Z01.411, possibly 419, and then Z12 codes, and start with 0.4, 0.7, 0.7, 0.89. So look at those areas to be able to report that. But I wanted to bring it up because it always seems to be a controversial topic of when can I report everything together, and when can I, when do I have to defer and just say that's not appropriate to bill together. So hopefully that gave you some clear insight, and you're not over or under coding, but you're coding what you actually do. Otherwise, you could open up a whole other can of worms. And just to be clear, just because you have a payer that pays for both still means that you have to perform both. So if you don't perform them, then you can't capture it. So always keep that in mind. Otherwise, you're going to run into all kinds of issues. Okay, well, that is it for me this week. I'm sweltering here in California. We've had so many days of over 95 to 105 degrees. It's driving me crazy. But I'm ready for some cool fall weather. I don't know about you guys, but I know I am. Hopefully everyone is excited like I am that NFL football season has started. I know we just had our first preseason game for Steelers. Yay, go Steelers. But we won that one. Not that the score matters in preseason, let's face it. But shout out to my podcast producer, Joe Kuzma, because he puts out some funny content with regard to how preseason games go. And I am going to come back this year and this season and do a What the Football podcast. I took a year off, or took a season off, because of how busy we were. I'm still pretty busy, but I miss doing it, and I've had some requests to bring it back. So for those of you that were also listening to my Steelers What the Football podcast through Steel City Underground podcasts, look for that each week once the season gets started. All right, everyone, have a really good rest of your week. Make it a great day, and thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1, or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.